For this assignment, we were asked to ask ourselves 4 questions about evidence-based practice. The first being, what is evidence-based practice? And in my opinion, it's using the best available research to aid in patient assessment, patient treatment, rehabilitation, and then their overall outcome, and then using that, in my own clinical practice. How do you utilize evidence-based practice in athletic training? The way I've always read it is being used when a patient hears about a different kind of treatment and they want to see if that would be better than the usual standby or the gold standard of treatment. So if a patient heard that using 4-way TheraBands for ankle sprains wasn't the best route, and then they gave me some other kind that they had read about, it would be my job then to do the research on both kinds and compare them to see which one is truly better for my patient. Do I feel prepared to practice evidence-based techniques? I feel like I understand the concept enough to be able to take the first steps towards practicing it. I feel like I at least know that I would at least know where to start if an athlete came to me wondering about a different treatment route. I would know which databases to use, what kind of articles to look for, and specifically what to look for in those articles. And then, how much experience do I have with evidence-based practice? I've really only really used it during this last year and a half, and I mean maybe more in undergrad without really knowing that it was evidence-based practice. But the first time I really even heard the term was last summer during our first day of class, when we learned that evidence-based practice we had to obtain those kinds of CEUs after becoming certified. But really only using it this year during research methods and our clinical class over just this last summer. So my goal with evidence-based practice is to be able to utilize it in our research projects, be able to find research on what I'm comparing in my study, and maybe have that as background as to what my outcome might be. And then hopefully using it maybe in my clinical site this fall, and then just overall getting that full 100% grasp on the concept and being able to talk about it comfortably, explain it comfortably, and all that.